Hello everyone, welcome to HIM 225. This is a continuation of the lectures covering chapter 23 in your textbook. Please turn to page 571 and we are at the bottom of page 571. And this guideline is coding additional perinatal diagnoses. And the guideline, we've talked about this earlier, basically tells us that we have to assign codes for conditions that require treatment or further investigation, prolong the length of stay, or require resource utilization. We will assign codes for conditions that have been specified by the provider as having implications for future healthcare needs. So the baby has some type of condition that maybe while they are not treating it on this newborn admission, they've identified it on this newborn admission, and it is going to require treatment in the future. And you have a note here that tells you that this guideline is not used for adult patients. So it only goes on this particular newborn record. Now on the top of page 572, we have a male infant that was born via a vaginal delivery. The clinician will evaluate and review treatment options for his undescended right testicle at the 6-week appointment time. Now we know that this is his newborn record, and of course our principal diagnosis code for this baby is Z38.00, our single live-born infant code, and then we're going to code those undescended testicles. So in the index, if I put undescended, you'll see testicle, and we go to crypto orchid. And you'll notice that there is a unilateral code. The documentation that we have does not tell us whether or not this testicle is in the abdominal area or the perineal area, so we are going to use this default code of Q53.10 and apply that to this newborn chart. Now, our next guideline comes from this section, disorders of newborn related to length of gestation and fetal growth. And when we go to this category list, we have 3 categories. P05, this is a disorder of slow fetal growth and fetal malnutrition. P07, short gestation and low birth weight. P08 is long gestation and high birth weight. So I want to look at this category P05. And you'll notice that the guideline basically tells us that in assigning these codes that we basically assign it based on the provider documentation. Prematurity is based on the provider documenting prematurity. When we look at P05, newborn light for gestational age, this term also includes newborn light for dates, and this includes weight below but length above 10th percentile for gestational age. And you'll notice as we look at these codes, the weights are included, the weight ranges are included with these codes, and the weights are in grams. So you'd be looking at the weight of that infant at birth and assigning the specific code for that weight. Now, if we look at P05.1, this is small for gestational age, newborn small and light for dates, newborn small for dates, weight and length below 10th percentile for gestational age. And again, when we look at these codes, the description of these codes, newborn small for gestational age, less than, and then it has the particular weight. So you would be looking for documentation that this newborn was small for their gestational age. You'd be pulling out the grams, and then the code you assign would be from this category based on that gestational weight. Then we have a code, newborn affected by fetal, intrauterine malnutrition, not light or small for gestational age. And again, you would look for that documentation. And it says this is an infant, not light or small for gestational age, showing signs of fetal malnutrition, such as dry, peeling skin and loss of subcutaneous tissue. So again, this would be very well documented in that baby's medical record. Now I want us to look at P07. Okay, so this is a category related to short gestation and low birth weight. And we have a note here that says, when both birth weight and gestational age of the newborn are available, both should be coded with the birth weight sequenced before the gestational age. So you'll see this category P07, extremely low birth weight newborn. And you'll see that this is, again, broken down by weight ranges. We also have another category, other low birth weight newborn. And then we have those ranges of weights. So this first section is for extremely low birth weight. Then we have other low birth weight of the newborn. Then we have extreme immaturity of newborn. And this is for newborns that are less than 28 completed weeks of gestation. And you can see that we unspecified weeks, and then age less than 23, gestational age 23, 24, 25, 26, 27. Then we have preterm, premature, newborn other, and this is 28 completed weeks or more, but less than 37 completed weeks of gestation. So it's prematurity NOS. And you'll see that we then have codes specific to the various weeks of gestation. And again, I want to remind you that you would typically have both the weight and the gestational age, and the weight should be sequenced before the age. So that's convenient because we have the codes for weight listed right here before the codes for gestational age. And then the next one we'll take a look at is P08, which is the other end of this spectrum. This is disorders of newborns related to long gestation and high birth weight. Again, the guideline is the same. If you have both the weight and the gestational age, the priority would be given to the birth weight. And again, extremely large newborn baby, other heavy or gestational age newborn. We have a post-term newborn period. The gestational period was over 40 weeks to 42 weeks. And then we have prolonged gestation of the newborn, which is over 42 weeks. Now, I'm not sure that babies get to that gestation in this day and time. I think they induce them and deliver them, but we have codes to actually reflect those long gestations. So let's look at this second example on page 572. A premature infant was born in the hospital via vaginal delivery. The baby weighed 4 pounds and was 33 weeks gestation. So this baby, regardless of whether or not the baby was premature or of a low birth weight, we're using the Z38.00 as the principal diagnosis code. And now our P07.17, that indicates P07.17. So we're going to convert the 4 pounds to grams, and you can easily do that on your laptop. You can Google convert pounds to grams, and then you can put in 4 pounds and you can see how many grams it was. And in this instance, our code that we're going to be assigning is in this range of 1750 to 1999. And then our baby was 33 weeks gestation. So we're going to come down to P07.3, and newborn gestational age completed weeks. We're going to go to 33, P07.36. Now in the index, I want to show you that if we go to premature, we're going to find these subterms, newborn, and it says extreme, see immaturity extreme, less than 37 weeks, preterm, newborn. So premature is a good spot to come to get the link to find these codes. So if we click on immaturity extreme of newborn gestational age, we'll find these codes here. And if we do less than 37 weeks completed, we can go to preterm newborn and find the codes here for the preterm newborn. Now in the index, if I go to low, I'm going to find birth weight. Under that, I'll find extreme. And you can see that these take you to the codes in category P07. But I also want to show you that liked for dates, you go to liked for dates in the index, and then it takes you to those codes in category P05. Now you may want to create some note cards to help you with categories P05 and P07. So P05 is slow fetal growth and fetal malnutrition. That is what this category is. P07 is newborns with short gestation and low birth weight. So don't confuse low birth weight with light for dates. So that can be confusing, but you're definitely going to have to use the documentation in the medical record to correctly assign these codes. And I also want to point out to you that in the guidelines in E on page 572, it tells you that these codes from category P07 can also be used for a child or an adult who was premature or had low birth weight as a newborn if it is affecting the patient's current healthcare status. The next guideline talks about bacterial sepsis of the newborn, and that is category P36. Now, in the index, if you go to sepsis and newborn, you will find these codes, and you can see that there are codes that are specific to organisms. There's also a specified NEC, so if the baby has an organism that is not included, you can use this P36.8. And if it actually is not specified as to what the bacteria is, you can use the code P36.9. But this is the category for bacterial sepsis of the newborn. And you'll see that it tells you to use additional code for severe sepsis and any associated acute organ dysfunction. This is the same guideline that we have for non-newborns who have sepsis. We would use the same severe sepsis code and also assign a code for any kind of organ dysfunction. respiratory failure, renal failure, that type of thing. Now, I encourage you to read these area categories carefully. They start on page 576 in your textbook. And your textbook also tells you that you should not be using codes from category P05 with codes from category P07. Now, you'll also notice that you have a guideline for a stillbirth, P95. It is very unlikely you would ever apply that code. Remember, this is a code that starts with a P, so it's coming from a chapter that can never be assigned to the mother's chart. It cannot be assigned to the maternal chart. And typically, if an infant is a stillborn, it is not born alive, it does not have its own medical record. All the information about that infant are included in the mother's record, and you apply an OB code indicative of a fetal death. But you would not ever put this code, P95, on the mother's chart. Stillborn babies are not born alive. They do not get a medical record number. They do not have an account number. All of their information is included on the mother's chart. Chapter 17, congenital malformations, deformations, and chromosomal abnormalities. These are codes that are never used on the maternal record. Now, the exception to that is if the mother actually has one of these conditions, you can apply it to the mother, but an infant's condition is never put on the mother's chart. And you can see the section list that we have for these. Basically, these are broken down by body system, nervous system, eye, ear, face, neck, respiratory system, digestive system, and so on. So when a baby is born on that birth chart, Z38 code is the principal diagnosis. Any code from chapter 17 would be a secondary diagnosis. Excuse me. Now, if that patient is readmitted for treatment of that congenital malformation or whatever, that code can be listed as the principal diagnosis code. And these codes can be used throughout the life of that patient. If the patient does have some type of malformation, deformity, and it is repaired, then you certainly can use a history of code for that patient. There are some of these conditions that, even though they're present at birth, they might not be diagnosed until later in that person's life. And so you can assign codes from this chapter at any time during that patient's life. Your question for this lecture, exercise 23.1, I want you to answer question 2. I want you to answer question number 9 and question number 11. So on page 573, questions 9 and 11, and that will be a multiple choice question for you. And I'm also going to go over the homework with you. Now for your homework, you're completing the chapter review exercises odd 1 through 19. So I want to tell you that all of these codes are either Z codes or P codes. So if you don't get a Z code or a P code, you have gotten the wrong code. Number 1 has 1 code. Number 3 has 2 codes. Number 5 has 2 codes. Number 7 has 2 codes. Number 9 has 1 code. 11 is 1 code. 13 is 2 codes. 15 is 2 codes. 17 is 2 codes. and 19 is 2 codes. And for all of these questions that have 2 codes, the first code is a Z code, and it is actually that newborn record, that newborn code. So when you're looking at these, if you have any questions about these, don't hesitate to ask. And that will conclude this final lecture for Chapter 23.